We set off, being a school of professional psychology, to integrate mental health considerations into the practice of HIA in a more rigorous and comprehensive manner. And there are at least two reasons why it made sense to do this. One is because mental illness is projected to be a leading cause of morbidity and mortality in the next 20 years. So you can't ignore mental health. And secondly, and this was implied by a couple of the speakers, particularly Kwame McKenzie, that mental health is a key mechanism by which the social environment impacts physical health.
If we believe that there's going to be a change in social determinants as a result of the change to policy guidance, part of that is going to be contingent on whether or not employers actually change their behavior.
We did a final report and executive summary, but we also did some open houses in the community. And instead of reporting the findings that Mark shared and we've all been talking about, we talked with our partners from the Safer Foundation, from Teamwork Inglewood, and from the Shriver Poverty Law Center, and just thought about what we heard from the community residents. And what they said was that people understand this process of arrest impacting employment, but when they go for jobs, they don't know how to talk about it. They don't know how to, advocate for themselves when they do have an arrest record. So instead of going out and doing another scientific presentation on our findings, we actually had those three organizations come out and do an educational open house to talk about, strategies that employment seekers can use to get jobs when they do have arrest records. So that was a different way and a different strategy.